Disclaimer before we begin. We want to remind you that the content shared on this podcast is for informational and educational purposes only. It is not a substitute for professional mental health treatment, diagnosis, or therapy. If you are experiencing a mental health crisis or need personalized care, please seek help from a qualified mental health professional. Thank you.
Welcome to the Zen Life Podcast. I'm Tawanda, clinical therapist, and as always, I'm here with my co-host Chico. How are you doing today, Chico?
Absolutely amazing today. Hey, welcome everybody. Thanks for joining us. We got a really good topic again today. We're going to keep on going with the thing we've been going for March. So let's get it.
Yeah, we've been talking about spring renewal and weight loss and holistic weight loss approaches. So we're going to keep the conversation going because as you know, it's not just about how we eat or what we eat. There's a whole science behind weight loss. And in honor of that, we have a very special guest with us here today. We have Dr. Kara. He's the owner of Health Wellness 360, a local physician here in the Memphis area. And he's going to talk to us about his background working with obesity health and holistic wellness as it relates to weight management. So how are you doing, Dr. Kara?
I'm doing well. Thank you. Thank you, Wanda, and thank you, Chico. It's been a great to work with you guys personally, one-on-one, but thank you for inviting me here.
Yeah, absolutely.
Yeah, we're absolutely excited to have you. You know, just building up to this moment, just knowing you, the time we've known you, and you've been the expert that you are. We know you're going to give them some good information. So we thank you for joining us today.
Thank you.
So your practice, I know, specialize or work with obesity management, just holistic wellness. I know our first encounter was me as a patient because I was having some blood pressure issues. And I must say that it was really, a pleasure working with you. You were very attentive and made the conversation really lighthearted because it was the first time that I had ever, had that experience before. And so as a result of that, I really I started kind of working on some holistic methods myself, just in terms of improving my blood pressure issues that I was having. So I do appreciate.
And my first impression of you was I went to the doctor with her, and all of a sudden you called me back, and I was stunned, right? Especially when I ended up laying on the table and they're turning the light off.
Because your blood pressure was high.
I wonder why. I was like, wait a minute, I didn't come in here and all of a sudden, but it worked out for the best because it made me more conscious and you made me understand that it's my responsibility. And a lot of it is that having the awareness, having the responsibility and knowing it, right? So I want to thank you for that personally, Doc.
Thank you.
Yeah, for sure. Because just to branch off of that, Chico really has gone hard on like a holistic kind of approach to his wellness, really since starting that journey with you. And, he has a whole multifaceted kind of, different areas of his life that he's working on.
Yeah, it's one of those things to where these things really, right? But it's a lot easier not to even do them or engage in them, right? It's only when you have an informed conversation, with somebody of expertise like yourself, to where you're like, okay, this is not rocket science, really. I can do this, but it just takes ownership on my end.
Yeah.
And I think it's a collaboration. I think the biggest thing is I'm skilled with doing as a medicine, as a physician. But when patient comes with a mindset that they are open to listen, open to understand what we can do, then there's a great things comes out. Chico and me work together and understand him. And for you, both of us, you are open about what needs to be done right now and what needs to be done in a long term and come up with a practical solution that we've been giving this body. Mm-hmm. And we have a big responsibility towards taking care of that tool, which will kind of encourage us to help other people.
Yeah,
absolutely. But look, it was a big fight, Doc. When we left there, I was madder than a hatter. like you set me up. But you know what? The end result, right? But when we got back, I was like, oh, baby, you got me good. But it did get the wheel to turning. So I'm really grateful and appreciative for that.
So our goal for having you here today is, I know your practice, Health 360, you specialize in holistic weight loss, encompassing a multidisciplinary approach. But before we get into that, why don't you just tell us a little bit more about you and what got you interested into this field?
Yes, my name is Dr. Kaushal Kalra, and I have spent my time studying human body as a board-certified physician in family medicine and obesity medicine. Mm-hmm. I graduated from SUNY Downstate, which is State University, New York, Brooklyn. And it was a great experience working, and I was living my dream. I was waiting to finish my MD, and I wanted to serve community. And I started taking care of patients every day, and it was a fun moment for me until I realized every day I look into the eyes of another patient, and they are crushed beneath the burden of a chronic disease.
Yeah.
It's not about the weight on the scale. It's about the crushing burden that is smothering joys out of millions of lives.
Yeah.
And during that experience, I was in Michigan at that time. Almost a year that I've been trying to understand where am I going wrong, because I am doing everything potential to help these individuals treat hypertension, diabetes, doing it in the most holistic way in the clinic. Mm-hmm. But I'm seeing that things are getting worse. Prevalence of diabetes is going up, prevalence of hypertension going up, prevalence of heart failures.
So it sounds like it was, you started seeing these trends and you really wanted to have a positive impact.
Yes.
But we're going to keep talking. We up against